Hi everyone, I have a question for you. Do you smoke marijuana? Do you eat cannabis edibles? Have you ever wondered if they're compatible with the medication that you take regularly or occasionally? I have the answer for you. Before we start, I will give you a little rundown about drug interactions. There are two types of interactions that you need to understand in this video. The first one is what I call the attacker-victim interaction. In this interaction, you have one drug that I call the attacker that changes the amount of another drug circulating in your body. I call it the victim drug. When the amount of the victim drug is reduced, its effect is also reduced in your body. If it's increased, its effect on your body is increased too. The second type of interaction is what I call the effect battle. In this situation, there's no change in the amount of drugs circulating in your body. The change is rather on the effect that the drug has on your body. Two drugs that create opposite effect can lessen each other's effect on the body. Let me give you an example. If you take a sleeping pill to sleep better, and you decide to take at the same time something stimulating, like coffee, you will most likely feel less drowsiness from the sleeping pill, not because its amount has been reduced in your body, because of the stimulating effect of caffeine. On the other hand, if you take two drugs that produce the same effect, like a sleeping pill and alcohol, that common effect, which is drowsiness, will be amplified. If you want to understand the mechanisms behind the changes in drug amount in your system, visit my blog. Whew, that was a lot of information. What were we talking about again?
Cannabis and medication.
Oh yes, let's talk specifically about interaction between cannabis and medications. Currently, there are a few studies available that have looked at how cannabis interacts with specific types of medication that most people take. However, keep in mind that THC is the main component in cannabis that gives you that high. It has several effects on your body and can therefore impact the efficacy of certain medication and increase the risk of side effects of others. In other words, there are a lot of possible effect battle interactions. Let's take a look at some of them. Here are some examples of possible effects of THC on your body. First, it can act on your brain. It can cause drowsiness, it can decrease your attention, concentration, and memory. These effects can be more severe when combined with opioids, alcohol, benzodiazepines, and other sleeping pills. And considering that it affects your attention and concentration, it can contribute to existing ADHD symptoms. Therefore, it can interfere with the efficacy of your ADHD medication. THC use can make you more anxious and cause you to have psychosis. That can ultimately worsen certain conditions you might already have, such as anxiety, schizophrenia, and bipolar disorder. Therefore, it can interfere with the efficacy of mental health medications. Your heart can also be impacted by THC. With a high dose of THC, it increases your risk of heart palpitations. And when it is smoked, it increases the risk of stroke and the risk of heart attack. All of these risks are even higher for people with heart disease. Therefore, it can interfere with the efficacy of their heart and high blood pressure medications. Concerning your lungs, when THC is smoked or vaporized, it can worsen your asthma symptoms. Therefore, it can interfere with the efficacy of inhalers and other asthma medications. Some studies suggest that THC can decrease fertility for women and men. Therefore, avoid it if you're on a fertility treatment or trying to conceive. To sum things up, when it comes to all types of interaction involving cannabis and your medications, there are some elements to consider in order to determine if the interaction is serious. First, the strength of your cannabis product. How do you consume it? Do you smoke it? Do you vaporize it? Do you eat it? And lastly, you. Your age and your medical history can influence how cannabis will affect your body and your medications. All that being said, you have one important job, and that is to notify your doctor or your pharmacist if you use cannabis, whether it's recreationally or medically, in order for them to assess and monitor the risk of all possible interactions between cannabis and your medications. Hope you enjoyed this video. If you did, don't forget to give it a big thumbs up, subscribe, and hit that notification button. For more details, don't forget to visit my blog. The link is down in the description box. I also encourage you to leave a comment for any questions or more. Continue to refill your life. See you soon.